Tiffany Tagner of Davie, Florida has to figure out how to balance the checkbook and pay for baby number 3 without the benefit of health insurance. Her husband's company can't afford to offer employee health coverage.
You just have to grin and bear it and put it on credit cards, and that's about all you can do.
The stress and worry about medical bills doesn't help Tiffany or the thousands of pregnant women like her. They're married and earn income that puts them in the middle class. However, paying for health care insurance would break the bank, giving them a negative balance every month.
It gives me just this knot in the pit of my stomach. It's just awful to think that I have to actually pay thousands and thousands of dollars to do what is our right, is to have a family. We want to have 3 kids. There's nothing wrong with that.
The Broward County, Florida Healthy Start Coalition helps families like Tiffany's deal with the difficulties of being uninsured. Barbara Lesh works to find the help and services uninsured families need. She says the high cost of insurance is affecting families in increasingly higher income brackets.
Insurance has gone up so much that a lot of those middle-class people can't afford insurance. Our middle-class people fall in between. They don't qualify for Medicaid, but they can't afford the other.
A recent study found that women between the ages of 50 to 64 are nearly twice as likely to have problems accessing health care than men of the same age range. Barbara believes the work of identifying uninsured women has been made somewhat easier. Thanks to a state mandate, Florida doctors are required to give expectant mothers a questionnaire. It is used to determine pregnancy risks, and being uninsured is high on that list.
In each county, it's sent to the risk screening office that's run by the county health department. They then look at scores, as well as did the physician refer for Healthy Start.
Healthy Start is an example of how one state is handling the stress uninsured women face during pregnancy. On the national level, the debate gets more complicated. Any bill coming from Congress has to balance the needs of each state, but also work as a regulation nationwide.
We've got a hodgepodge, a crazy quilt pattern of coverage.
Ron Pollock is executive director of Families USA. This nonprofit group works to create a plan for an affordable health care system.
What we need is to create a national floor standard under which nobody can fall, irrespective of what state they are in, irrespective of their family status. That's the direction public policy needs to take. And my hope is that as this issue increases in urgency, we will move in that direction.
Pollock says the cost of health care now affects middle-class as well as working-class families. That, says Pollock, means the Capitol Hill healthcare politics will change in the near future.
It's critically important to start reforming America's healthcare system because with each passing year, we're seeing more and more people become uninsured. Last year, we had the largest increase in the number of uninsured in a decade. And it is likely to continue to increase because healthcare costs are rising.
Karen Ignani is president of an industry trade organization called America's Health Insurance Plan, which represents the industry in Washington, D.C. Ignani says health insurers realize there is a market of clients that should be covered.
So I think it's more about the healthcare urgency, and that's the reason we should act. Yes, there are economic consequences, but individuals without health insurance can't be productive workers. They can't take care of their families, and it has tremendous implications psychologically, economically, and sociologically, and we've got to deal with that straight up.
For Tiffany Tagner, her monthly budget comes down to paying for health insurance or paying for food and utilities. With 2 small children and a third on the way, Tiffany and her husband decided for now they will go without health insurance.
Oh, we'd be in the red every month by hundreds and hundreds of dollars. We were on a PPO and we did pay for individual health insurance for about 1.5 years, and we just simply could not afford it. It came down to, well, do you want to have groceries and transportation, or do you want to be able to have health insurance? And so health insurance lost.
Because the number of uninsured families from working class and middle class incomes has grown steadily over the past few years, Barbara Lesh and her team believe families will continue to need help until major changes are made.
They don't say anything to anybody. They don't want to rock the boat. They're embarrassed, all kinds of things. But that just increases their stress level. And increased stress can play into preterm labor, poor birth outcomes, low birth weight. So you don't want the mom stressed out because all it can do is hinder the baby.
With help from Broward Healthy Start Coalition, Tiffany is looking at insurance policies that will cover her children. But Tiffany says she and her husband will remain uninsured until she can go back to work.
If there's a job that I can be happy with, that's just a simple job where I can go and the hours are such that my husband could watch the kids, then that would be great. I would go back soon, 6 months or so. If there's a move that I can make to start a new career, then I would wait. I would wait until the baby's older, maybe 2 or 3 years old, because that would involve a daycare and childcare and so forth. So I haven't quite decided what route we'll be going.